Hi, welcome to my talk today. My name is Vitsa Pap, and I want to tell you a little bit about this research that I've completed quite recently. The reason why I started looking at the time course of the changes on testosterone was motivated by a number of things. First off, I noticed that there are quite a lot of biases that we introduce when we drag people into a lab and ask them to record themselves in a monthly installment or something. Second, I want to get more detail. Very frequently, literature on transmasculine voices record them before testosterone and then about a year into the testosterone treatment. And obviously, if you have 2 points only, everything looks like a linear change. And I had a strong hunch that this was not the case. And numbers, a lot of the research that was completed in the past decade, even if we add them up, like 2 people here, 10 people there, 7 people here, 5 people there, even if we add up about 20 articles, it's still going to take us to about 50 people. We are making decisions and we're writing articles based on 50 to 70 people's worth of data. No field dares to do that, I'd say. So I set out to try and add a hefty number of people to the already existing literature. Now, if you ever try to run research on transgender participants or people who want to move on various gender scales, you know that it's very hard to run a clinical study because to have, let's say, 20 people together in one geographical location, let's say, who are all starting in January, whatever starting means, whether they're starting in a social context, in a medical context, in an emotional context, psychological context, you define that. Let's say they starting in January and or February is nearly impossible. So I turned to YouTube. As a voice researcher, YouTube is an easy grazing field. What I did was I looked for the terms, number of months on T or testosterone in English, Spanish, Portuguese, German, French, Polish, Dutch, Swedish, Italian, Finnish, Turkish. I had Romanian and Hungarian in there. As you can see, there's a very strong European bias to this. And the reason for that is simply that these are the languages that I'm comfortable reading in, so I can run through the description in the particular language and understand if it's a relevant video at all. I would be very happy to reach out to other languages than just the ones that are spoken in Europe. So I try to include speakers who have at least a 10 months worth of time depth, ideally 12 months, and who have at least 8 data points in that 12 months, recorded at some sort of a structured manner, like on the month or so. And there was at least 1 data point before the onset of testosterone treatment, or at least 1 in the first fortnight. A lot of people are so excited about starting T that they forget to record themselves before. And then they're going to record themselves once a week, which is fantastic, but we need a baseline. I wanted to get at least 2 minutes worth of data out of a speaker, preferably not at the start when they're very enthusiastic, like, hello friends, welcome back. This is week 14 on T. Or the end of the recording when most people are like, and we will see you in a month's time. So I was trying to get something that is more characteristic of everyday speaking. And to make sure that I don't measure their conversational partner, I was only working with solo monologue speech. I try to make sure that I don't have children, pets, partners, noise, fridge, Hoover, cars, and background music, which is incredibly hard. Even with these narrowing constraints, I ended up with 108 individuals who I used for this analysis. I grabbed the video from YouTube, turned it into an audio, made sure it was the right format. I gathered the voicing cycles, and then I interpreted the distributions of these voicing cycles in each individual clip 10 or 12 times in the first year on testosterone by each individual. So I had a couple of thousand sound clips. Here's a snapshot that will help you put your mind around the data. What you see here is time on testosterone. So this is time 0, which is pre-testosterone. This is 6 months on T, and this is 12 months or a year on T. And on the other axis, you see the individual measurements. So someone who is at 200 hertz is reasonably characteristic of young, cis, gender, female speakers in Aotearoa today. And 140 or 130 hertz, just to give you a ballpark, is something we regularly measure, somewhere between 120 and 140. We measure cisgender male speakers in Aotearoa. As you can see, the trend is that people start out somewhere around 180, give or take, plus minus 30, 40 hertz, and then cover the largest amount of their journey in about the first 6 months, but the changes don't stop and carry on well after 12 months, actually. So if statistical modeling makes you squeamish, tune out for just 1 minute. I tried to assume that this is a linear model and the residuals broke it. So I assumed that this is a quadratic model, and I introduced a so-called orthogonal time component structure to the data. I also assumed that these are going to interact with the speaker. So the result is that the quadratic model that assumes that this is a bendy line as opposed to a straight line, it's a better fit, but there were still residual patterns that I tried to mine out. So I assumed that this was a cubic fit. So it became a three-way orthogonal time term structure to the model. And it was the best fit. I tried the coronary on, but it introduced unnecessary complications at the expense of not much improvement. So we're going to run with the cubic model. Come back now. I'll speak English now. So what can a cubic model tell us? The first time term is simply just how much did people drop. They started out here, and then he ended up here. And as a result, this is the journey that they took. Next one is the second time term simply tells, was this a linear journey or was it a bendy journey? So did they start really fast and then they petered off, or did they linger a little bit and then they zoomed down, basically? A third one allowed me to see if there was a change point. So if someone does a linear move, there's no change point. If someone does a curve here, there was a change point before they started dipping down. Or if someone zooms down, there's going to be a slight change point when they kind of slowed down. So one change point we would kind of sort of expect. But what if there are multiple change points in some people's journeys? So did they go down and then lingered and then curve back up? So this is what term 3 allowed me to check. So the structure of the data was just name by terms, the 1, 2, 3 time terms. And this is a very hard way to interpret it. If you're into it, I'm very happy to share the data with you. But let me show you in a more visual way some of the ways that we can discover individual differences here. Here is one speaker. Let me show you how you read this chart. So this is the time on testosterone. So this is month 0, the baseline, and this is month 12, 1 year into the testosterone therapy. And next up, what you see is the pitch, which is this end is the more feminine end, and this end is the more masculine assumed end of this axis. So what you see here is James started out somewhere at 20 hertz, 220 hertz, lingered there for about 2 months or so, and then zooms down. And then by month 6, he completed most of his change, and then he very slowly migrates down for the rest of the time that I measured him on. Let me show you someone whose first time term shows us that this person went through very little change despite very meticulously recording himself over 12 months. So he started out somewhere at 190, and by the end of the 12 months, there's a slow tendency down, very slow, and he ended up somewhere around 180, somewhere 170 hertz. Just to put it in context, I probably speak somewhere around 170 now. Now, let me show you the second time term. So that shows us how someone behaves. So in the first 6 months, we noticed that this person didn't do much of a change, but then, boy, did they zoom down, right? But the converse also happens. Someone zooms down, and then they stagnate for the rest of the in this case, 11 months. And then finally, I wanted to show you what time term 3 shows us. That is, if there are change points other than the curvature in it. So what you see here is this person starts out, goes all the way down, but then something happens either in their physiology or in their identity or in their behavior that makes them curve back up a little bit and then ping pong here for a little while. This is not the clearest example, so let me show you one that is really quite S-curvy in this way, as opposed to just a C curve. So this person starts out actually quite low, very quickly covers the ground all the way down, and then spends the next 6 months coming back up, basically all the way to month 2 on testosterone, and then something happens again, and they start curving down. As you understand, I have no ways to explain what drives these changes, but their existence, just pointing them out, I think is quite important. So a couple of more examples, because probably the biggest result coming out of this research that goes against the literature is the fact that quite a lot of the speakers, basically some 30 out of the 108, which is 1 in 4, give or take, 1 in 3, 1 in 4, curves back up. So again, this person goes down, and around month 6, they start going back up till month 10, and then maybe start wobbling back down. Or someone who starts at very high pitch, so 210, 20 hertz, parks a little bit for 3 months, and then boom, zooms down. And then something around month 8 happens, and then they start curving back up, and they arrive back to where they were at month 6, basically. Or someone who undoes pretty much all the change they've done, or not all of it, but very close to it, and goes back up to where they were in month 1 of their journey. So the things that I want you to take away from this talk is that just talking about that someone went from here to here is a tiny part of the story, and what is between here and here is incredibly exciting to understand. It speaks a lot about not just the physiological results of testosterone, but also what behavior layers on top of physiology. The time course, understanding the time course of the changes, again, is something that points well past physiology. What people tend to assume that transmasculine speakers only experience in their own changes. It's not just a blunt force that hits you, that you are there, you're driving it. The obvious takeaway, this is barely ever a linear change. I probably can say that 2 people had a nice straight stick of a change, but not many more. And if you want to show off to your statistical friends, say that this is a clear quadratic or cubic progress, which is very frequently turns into a cubic change after a change point and trends upwards. Now, in the future, I'm planning to add more variables, as well as more speakers, as well as more languages, because we know that the time you start testosterone, what your first language is, whether it's, let's say, a PACA speaker of English versus you are a speaker of Te Reo Maori, actually already straight out of the box will induce differences in where you start from and where you're actually heading towards. And finally, to tie it back into my previous talk, the resonant changes, the concurring resonant changes are also very interesting to explore, whether these move together or move opposite or in a contrapoint from each other. So thank you for your attention. I'm very happy to take questions or comments or feedback or data or volunteers. This doesn't stop here. Thank you.
Kia ora koutou katoa. Many thanks for having me along today. It's a real delight to be here. My name is Jen. and I'm a speech and language therapist, and I'm the founder of ReVoice Clinics Speech and Language Therapy. Today, I would like to talk to you about ReVoice Clinic. I want to introduce it to you and tell you about our ethos, our client caseload, referral criteria, and commonly what clients come to me for. And then I want to take you through a little bit of a journey about just understanding how gender affirming voice and communication therapy looks and what's the history of it, a little bit about therapy, and I will end with some case examples. I've been practicing as a speech and language therapist now for over 12 years, and I've trained in the last 3 years in yoga therapy. And I'm very interested to bring the field of traditional speech therapy intertwined with traditional yoga techniques. I can see so many connections, and forming ReVoice Clinic has really enabled me as a clinician to merge these teachings and really work quite holistically with clients. So, when we look at voice, yes, there's the physical health, and that's when, I have that understanding of vocal science, but also we have the psychological health, the health of the spirit, and bringing yoga into that. When we look at yoga, I'm talking about breath work, I'm talking about positive affirmation statements, posture, and you can really understand that so much of that is interlinked with voice. So, um, bringing both practices together has been incredibly rewarding as a clinician. And also reminding myself of Te Whare Tapuwha, the Māori health model, in the holistic treatment of the individual. The ethos of ReVoice Clinic is to provide a specialist speech and language therapy service in line with evidence-based practice, and for that service to be accessible to anyone, no matter where they live in New Zealand. And the way to do that is to provide it via telehealth, which has been very effective. I also think it's really essential to work in partnership together with clients so that they can be inspired to quickly meet their goals and to then be able to self-manage their voice and communication for many years ahead without the need to rely on seeing a therapist. So I started this business in March 2020, which we might all remember was a significant time with COVID hitting New Zealand. So I flew back from the UK, deciding to put my feet on home soil. And in that time, I have had 35 people refer from word of mouth, website, Facebook, and 2 referrals from ear, nose, and throat doctors. So 32 of those people have been trans female and 3 have been trans male. And this simply reflects that hormone replacement therapy lowers vocal pitch for trans males by thickening the vocal folds due to testosterone. Hence why most of probably what I'm going to talk about today is more aimed at the trans female population. And 2 have also been non-binary. One of these clients has gone on to remain on the wait list with the ear, nose, and throat surgeon. And on average, people have come to see me about 6 times. And more recently, most people are coming back for 8 sessions. And in that time, they can really transition from having no idea what to do to fully emerging a new preferred voice in general conversations. The referral criteria, so it's really important that somebody, obviously they want to change their voice and communication. They're prepared to practice using this new voice in front of the speech therapist, committed to home practice, and are committed to using real life situations as a time of practicing outside of the clinic situation. And exclusion criteria are people who aren't concerned about their voice or have significant psychological distress, which impacts on their ability to participate. And somebody who has evidence of a voice disorder in which case I would refer them to see an ear, nose and throat surgeon first. Common complaints. So these are some things that I hear clients say a lot. So they have no idea where to start, but they know that they want some change. They feel held back with their transition due to the inability to transition their voice on their own. They find online videos unhelpful. They get no feedback. They're not sure what the end goal is. They feel embarrassed by attempts to change their voice. Commonly, they are misgendered on the phone, which can be a real big thing for people who work primarily on the phone. Unsure how to change their voice in a healthy way. So often people say, oh, my voice is really achy, it's really strained, I can't keep the voice up for very long. Some people come to me and say they actually are not too worried about their voice, but they really want to explore the language they use, the phrases that they use to align more with their gender identity. And there is absolutely no doubt that there are common themes around reduced social and occupational roles due to gender dysphoria, anxiety, and just the ongoing feedback from others of being misgendered when they communicate with them. So speech and language therapy, there's been research from the mid-20th century about the communication differences between cis males and cis females. And I guess the main point is just to really acknowledge that this is widely variable and that there's many coincidental links between gender and social dimensions like occupation, culture, education, and also a lot of these studies were completed many years ago, and in that time we've had huge shifts in society and societal norms. So this research though does form a really useful base as a therapist to understand just how we can tweak different aspects of communication. So for example, we can change pitch, we can change volume, we can change vocal quality and resonance, prosody, articulation, vocabulary, pragmatics, and non-verbal communication. So at the initial consultation, the client would establish meaningful goals. I would find out what motivates them and how they learn best and complete an acoustic and a perceptual voice assessment. And during each therapy session, there would be a different aspect of communication focused on depending on the client's goals. So that could just be pitch and articulation, or it could be, many more things. There is often a lot of education and counselling to the client to help them to achieve their goals and understand the rationale for completing therapy exercises. The client will improve their kinesthetic and auditory monitoring for ongoing independence with voice therapy. And they always would start from single sounds and gradually transition into conversational speech with that ongoing promotion of let's find out what feels right and sounds right for you. So here's a little diagram on the left of the vocal folds, the two white folds. They come together when we voice and they open to breathe in. So the vocal folds are the vibrator, like the reed of a clarinet, they're the source of the sound. And on the right-hand side, we can see lower down, we have the vocal fold, and then we have the resonating chamber, which is the nasal cavity, the oral cavity, and the tongue and the palate, which are constantly moving around to vibrate the sound in different ways, resonating it to create different sounds. So when we look at shifting resonance, this is a common technique in voice feminization. And what you'll see here is this is the fundamental frequency, so the average pitch. And above that, we have these upper harmonics or formants. And that here, these upper harmonics are what makes the voice sound more female without putting too much strain on getting the average pitch up. And you can see that there's other sounds which really lack those upper harmonics. So we can learn to shift resonance forward so that all vowel sounds have these upper harmonics and sound more. And another part of therapy is being mindful of the power. So what makes the vocal folds vibrate? That is the breath and posture. So clients can really learn to optimize breath using the abdomen and release the breath in a efficient, energy efficient way. And that really leads into posture as well. In order to breathe properly, we need to have an optimal posture. And then we can manipulate posture in order to affirm more with the preferred gender. So we know that one huge example would be that male speakers tend to use their hands a lot more, whereas females tend to kind of have that more hunched over posture. So there's just some universal differences which can be explored with clients. I'd just like to finish with an example of a 15-year-old. So the first recording is during the first session.
When the sunlight strikes raindrops in the air, they act as a prism and form a rainbow. The rainbow is a division of white light into many beautiful colors. These take the shape of a long round arch with its path high above and its two ends.
And now this is a recording of the fifth session.
When the sunlight strikes raindrops in the air, they act as a prism and form a rainbow. The rainbow is a division of white light into many beautiful colors. These take the shape of a long round arch with its path high above and its two ends apparently beyond.
So we are yet to work on bringing emotion into voice and exploring posture and body language, but I thought that was quite a realistic example of how in 4 or 5 sessions somebody can make quite significant improvements, and she's already starting to use that voice in spontaneous conversation.
When the sunlight strikes raindrops. When the sunlight strikes raindrops in the air, they act as a prism and form a rainbow. The rainbow is a division of white light into many beautiful colors. These take the shape of a long round arch with its path high above and its two ends.
So take home messages. We all have the capacity to change our vocal instrument. Voice therapy is very effective in the trans-diverse individuals. Commitment to home practice is essential to create new muscle memories. Finding the right time to focus on vocal transition is important to making meaningful change. Telehealth, lots of studies in the last few years on voice therapy and telehealth, and there are no clinical outcomes changes between face-to-face and telehealth known in the research, which is great. Vocal feminization surgery is a possible treatment option, but it's only advised to complete after a very intensive block of voice therapy first in order to prevent the possible risks and side effects of having voice surgery. And although there are voice gender norms, it's really important to acknowledge that gender is on one continuum, and we need to promote clients to go on a voice journey which is authentic to them. Thank you for listening, and I'm very happy to answer any questions. If you'd like to contact me, I've listed my contact details below. Thanks.